The epithelium lines the lungs and the tracheobronchial system. Inside the epithelium are cells, whose job is to divide, reproduce, and repair worn-out or injured lung tissue and allow for new growth. A cancer begins with an error or mutation in a cell's DNA. DNA mutations can be caused by normal aging processes or through environmental factors such as cigarette smoke, breathing in asbestos, or exposure to radon gas. It takes a series of mutations to create a lung cancer cell. Before becoming fully cancerous, cells can be precancerous in that they have some mutations but still function normally as lung cells. When a cell with a genetic mutation divides, it passes along abnormal genes to the two new cells, which then divide into 4 cells with errors in their DNA and so on. With each new mutation, the lung tissue cell becomes more mutated and may not be as effective in carrying out its function as a lung cell. If these cells lose their ability to control their division, they will grow excessively, forming tumors, and lung cancer emerges.
There are 4 main types of lung cancer. Small cell lung cancer is grouped by itself, and the other 3 types, squamous cell carcinoma, adenocarcinoma, and large cell carcinoma, are collectively called non-small carcinoma of the lung. Type of cancer is determined by the appearance of the cells under a microscope. Primary lung cancer starts in the lungs. The cells are abnormal lung cells. Sometimes people will have cancer travel from another part of the body or metastasize to their lungs. This is called secondary lung cancer because the lungs are a secondary site compared to the original primary location of the cancer.
Symptoms of lung cancer are often dismissed as normal symptoms of a common cold, so lung cancer is often not diagnosed until it has progressed to stage 3. Some symptoms include a change in a chronic cough, particularly if you're a smoker, if you're coughing more often and it has a different tone, or if you're coughing up blood or mucus. Those are common symptoms. If cough lasts more than 2 weeks, it is time to go see a doctor. Shortness of breath or wheezing from lung cancer can be caused from the cancer blocking or narrowing your airways. Pain in the chest area, a raspy voice, or a change in your tone of voice can also be symptoms of lung cancer, and a drop in weight from cancer using the energy in your body.
There are 3 different ways to diagnose lung cancer. There's imaging tests, which can be performed with a spiral CT scan, which they can detect early lung cancers or small lesions. There's also x-rays, which are another example of imaging tests. Or you can also tell if your doctor sees that you have chronic cough or wheezing, and they can order more tests. Then there's also sputum cytology, and that's when you cough up phlegm for a sputum test. What they do is they check that sample for any cancer cells. And then there's also needle biopsy, which if cancer is present, then they take a small sample of the mass and it's removed with a needle to examine under a microscope. And the pathologist who is examining it can determine if the tumor is cancerous.
Treatment of lung cancer kind of starts with just prevention, so you want to have a healthy lifestyle. So you just drinking water, getting rest, and just not smoking, which is the big factor. If you get diagnosed with lung cancer, the goal is to try to eradicate or remove the cancer by limiting the amount of cells that keep going through the mutation. So some of the common treatments, I guess, for lung cancer are radiation, chemotherapy, or just removal of part of the lung with lung surgery.